Well, I think one thing is to know that the training alone is really not enough. So I think training is absolutely essential. I don't think you should just hand the guide and think that a clinician is going to feel comfortable asking these questions. But that training alone isn't going to change the problem. We really need all the other components of the program, which are patient identification, reminders, and documentation standards to make sure that all patients that have serious illness have appropriate conversations with their clinicians about really what matters to them most. So the other thing that I would say is leadership support is incredibly important. When we implemented at the Dana-Farber, we went to all our different disease centers, and the disease center leaders who were really proponents of the program and really said, this is, standard of care, that we should all do this. Those disease centers really jumped into the program and did, enrolled a lot of patients. And so it was really a lesson for me in how important leadership support is. And then the last thing is the documentation piece. I think you really need the documentation in order to make sure that every patient has a good conversation every time. We need ways to measure that. And so that's still a bit of a challenge. And I think spending time on having mechanisms to do that is important.